We are so lucky to have Professor Ogata, who is a worldwide expert from America to Asia to Europe on IBD. So please, Aru, just introduce your data. We discuss all at the end. Thanks, Ogata.
Thank you very much, Cesare, and it's my pleasure to have a chance to talk. And compare with the chronic neoplasm, especially regarding for the development of AI system or CAD, some kind of research was not so good high speed compared with the chronic neoplasm. IBD area is not so highly advanced, but current situation, as far as updated knowledge, I'm going to introduce shortly. So please start my video. Hello everyone, I am Haruhiko Ogata from Keio University, Tokyo, Japan. Thank you for inviting me to NEC Special Symposium, AI and Robotics. My research interest is IBD, and I am also in charge of the Committee of Promotion of AI Development in Japan Gastroenterological Endoscopy Society, JGS. So in this symposium, I'm going to overview the current status and future perspectives of CAD development, especially in the field of IBD. There is no COI. In the field AI technique of GI endoscopy, recent main research has been focused on colon polyp detection, as shown in this slide. So how about IBD? This table shows the use of AI in identification of patients with inflammatory or other non-malignant diseases or regions published in Gastro this year. As shown, regarding IBD, main research target is Crohn's disease, and diagnostic modality are video capture endoscopy. So how about ulcerative colitis? In most of clinical trials, endoscopic score of Mayo 0 or 1 is defined as mucosal healing in patients with UC. A high inter-observer variability exists when evaluating endoscopic inflammation in UC using the Mayo Endoscopic Subscore, MES, and or UC Endoscopic Index of Severity, UCIS. No consensus exists on the exact definition of mucosal healing in UC. So that histological inflammation might be also predictive for relapse in UC, even in patients with endoscopic remission. Last year and this year, several reports have been published regarding UC activity, analyzing using CAD systems. Tokyo University Group published the CAD system for endoscopic disease activity in UC patients. A CNN-based CAD system was constructed based on GoogleNet architecture. The CNN was trained using more than 26,000 colonoscopy images from a cumulative total of 841 patients with UC, which were tagged with anatomic locations and Mayo endoscopic scores. The performance of the CNN in identifying normal mucosa, Mayo 0, and mucosal healing state, which is Mayo 0 to 1, was evaluated in an independent test set of approximately 4,000 images with UC by calculating the areas under the receiver operating characteristic curves. The performance of the CNN-based CAD system was robust when used to identify endoscopic inflammation severity in patients with UC, highlighting its promising role in supporting less experienced endoscopists and reducing inter-observer variability. Professor Nakase in Sapporo Medical University and University Hospitals Leuven group in Belgium developed new CAD systems detecting mucosal inflammation as red density. The algorithm red density was based on the red channel of the red, green, blue pixel values and pattern recognition from endoscopic images. To validate the algorithm, they tested the correlation between red density score and clinical, endoscopic, and histological features in a validation cohort. They constructed the algorithm based on the integration of pixel color data from the redness color map along with vascular pattern detection. These data were linked with Robert's histological index in a multiple regression analysis. The results shows in the construction cohort, red density correlated with histological index, Mayo endoscopic subscores, as well as UCEIS, and then concluded that red density provides an objective computer-based score that accurately assesses disease activity in UC in a validation study. Red density correlated with endoscopic and histological disease activity. In Japan, using endocytoscopy, EndoBrain system appeared last year, which can dedicate to support doctors' diagnosis of neoplastic or non-neoplastic in real time by AI in sporadic colon tumor. And further, CAD system against UC inflammatory evaluation support, which was named EndoBrain UC, has been developed and approved in Japan this year. This is the only one AI system which has obtained regulatory approval in Japan. In this system, AI analyzes the images taken under NBI observation with the endocytoscope and displays the possibility of histologic inflammatory active or healing in a real-time fashion with 91.9% accuracy and 95.1% sensitivity. As you know, for further development of AI in GI endoscopy, strong cooperation with industry, government, and academia would be crucial. So that JGES, Japan Gastroenterological Endoscopy Society, will continue to support and encourage the close relationship among these three independent fields. These are the sporadic early colon cancer findings with chromoendoscopy, endocytoscopy, and histology with HE staining. The lower panel shows the colitis-associated cancer findings. In fact, many doctors raised the questions. In ECS, easily to make diagnosis of UC-related dysplasia or cancer by AI? The answer is currently no. At first, to find the suspicious region of dysplasia by conventional endoscopic observation is still necessary. However, it is not so easy to detect the flat region in active mucosa. On the other hand, if you find the regions, ECS will be able to make diagnosis easily instead. Thus, to brush up more sophisticated technology would be necessary to read a breakthrough. Why this is an exciting moment in AI or computer vision right now? In the past decade, human performance acuity was superior than AI, and now in many fields such as conversational speech recognition, driving vehicles, games, or classifying skin cancer, it's just timing of a cross-breaking situation. And near future, you will be able to imagine the situation which we learn from AI. And the development speed is so fast. Within the next 5 years, not only vision, but also many deep neural networks such as speech, language, search, and robotics will be making significant strides. This is my last slide. Let's stop with the human versus machines debate, which is already a worn-out phrase. Thank you for your kind attention.
Thanks, Aru. I mean, the IBD field is amazing. Our dream in Europe is to replace traditional chromendoscopy with AI, but we will discuss later. Let's move now to Barrett.